In this webinar, we shall learn the need for timely resuscitation of preterm newborns and its effect on short and long term outcomes. I would like you to note that in India, every year up to 15% of newborns are born preterm. The preterm population contributes to almost 35% of all neonatal deaths. This is a huge burden indeed. One of the important causes of preterm morbidity and mortality is perinatal asphyxia. Skilled and timely intervention in the delivery room can help improve short term and long term outcomes of these preterms. It is well known that prematurity is a risk factor for resuscitation at birth. Compared to term newborns, preterm newborns have a higher chance of requiring resuscitation in the delivery room. The need for equipment and skills for preterm resuscitation differ from term newborns. Hence, we need to have skills to manage preterm asphyxia appropriately. There are multiple problems a preterm may develop in the delivery room in addition to asphyxia. These include hypothermia, respiratory distress, hypoglycemia, hypovolemia, which may further complicate the course of asphyxia. One needs to anticipate and take appropriate steps to care for these multiple problems in the preterms at birth. Let us understand why a preterm is at risk for multiple problems at birth. Preterms are at high risk to develop asphyxia because of poor respiratory drive, poor muscle tone and immature brain functioning. Hypothermia is more likely in preterm newborns because of lesser body fat, large body surface area and limited thermal responses. Breathing difficulty may be due to immature lungs, weak muscles or immature respiratory drive. Smaller blood volume loss may increase the risk of hypovolemia, predisposing to shock in preterm newborns. To anticipate is to be prepared and to act appropriately. Thus, we now realize that to manage a preterm at birth is a challenge. We need to be prompt and act in a timely fashion in a stepwise manner to assess, support and maintain temperature, airway, breathing and circulation. Appropriate actions can help improve short and long term outcomes. Having understood what the problems are and why the problems are in the newborn, we realize that all newborns need assessment for need for resuscitation at birth. Provision of warmth is a must for all the newborns, and in majority the initial steps and or bag and mask resuscitation should suffice. Very rarely one may need advanced steps of resuscitation like chest compression and or intubation. To conclude, timely skilled resuscitation by simple easy to practice steps can help improve short term and long term outcomes. Thank you.